Hi, I'm Dr. Castanet. I'm going to talk to you a little bit about spine surgery today. I work at a neurosurgeon's office or spend time there every week, and I continue to learn neurosurgical indications and procedures. I have a tremendous amount of respect for what neurosurgeons do and spine surgeons generally, and for all healthcare providers that are trying to help patients with difficult neck and back problems. When it comes to spine surgery, I just need to talk generically about a few things to give you some perspective on how to think about spine surgery. Spine surgery is a huge topic, of course, and there's no way I can treat this comprehensively, but I want to talk to you about a few things. First, as regards the low back, there are some common surgical procedures. Probably the most common is a simple microdiscectomy. That's where surgeons make a small incision, probably 1 inch to 1.5 inches long, along the midline of the spine or just off to the midline of your spine. At the level where you have a disc herniation, they go in through that region to reach the disc that is herniated and sticking out into the canal or putting pressure on a nerve root. They remove that mass of disc tissue, and that's it. They get pressure off of the nerve root. Typically, it'll take maybe an hour to do that. You'll come out of the surgical operating room, and your leg pain is typically better right away. Nonetheless, it is a surgical procedure, and neurosurgeons, good neurosurgeons and spine surgeons will tell you that you never take surgery lightly. You undertake surgery when you've exhausted your non-surgical options, and when you are miserable, and when you have a surgical lesion on an MRI scan that is amenable to improvement with almost certainty with surgical treatment. Surgery is not to be undertaken because you have mild pain. It's not to be undertaken in the absence of having exhausted your non-surgical options, including physical therapy, spinal decompression, and injections. There are some patients that are misguided in that way, and they have to be disabused of that by whomever they see. And if they see good doctors, they will all hear the same thing, that surgery is appropriate and can be a blessing and under the right circumstances, but it's not to be taken lightly because there is some chance that something may not go so well. So you also want a good patient with an appropriate perspective on the surgical outcome. The more miserable they are on the front end, the more likely they are to be happy with the surgical outcome on the back end, and that means a person that has reasonable expectations and has chosen it under reasonable terms. So that's the most common surgical procedure. Another quite common surgical procedure is something we call laminectomy and spinal decompression. That is when there is compression of nerve roots, or could be on the spinal cord, compression of the spinal cord if we're speaking of the neck region. And spinal decompression surgically means removing some of the tissues. That typically means disc tissue and some bony elements and some ligamentous tissue to make the space available for the spinal cord and or nerve roots greater so that there's less pressure on them. That's usually a relatively simple procedure also, depending on how many levels are involved. It's generally well tolerated, and the surgical outcomes are very good in the right patient. So I encourage the appropriate patients to do that as well. But when it's appropriate or not is a decision you have to make with your physician and with the particulars of your case. The next surgical procedure I'll speak of is a bigger undertaking, and that's surgical fusions, whether in the neck or the back. Surgical fusions involve just that, fusing one of the vertebrae to another, sometimes at multiple levels, sometimes at as many as 10 levels. This may be done in the neck or the back. It's generally done because there is a source of pain at a disc that hasn't improved with a simple discectomy, or it may be because there's instability, meaning the two vertebrae or bones move more than they should. It is sometimes done to straighten out a spine. It's sometimes done to improve what we term the sagittal balance, or the posture of the spine. So a surgical fusion may be done for a number of reasons. Now, surgical fusions are a much bigger undertaking than a simple discectomy or laminectomy. And you need to be informed and counseled about the various procedures and what's appropriate for you, what's being recommended and why. So there's much to discuss with you specifically about your case as regards whatever surgical procedure is being recommended by your surgeon. I speak to patients all the time about the various procedures, what I think is appropriate for them, and what they'll likely be recommended by the spine surgeon. I spend time at a neurosurgeon's office every week, so I'm familiar with the surgical indications and procedures, and I generally have a pretty good sense about what's going to be recommended surgically. But again, those are particulars that will vary with your specific case. So those are the three general surgical procedures. I can discuss them with you at greater length. There are websites also where you can go to learn more about these specific surgical procedures. But you should know that in the right circumstance, surgery can be a blessing. Many people have good surgical outcomes from any one of these three procedures. It's also true, however, unfortunately, that sometimes patients are not well selected. Some patients are too aggressive. Some surgeons and patients are not respectful enough of the limitations and are not judicious enough about choosing the right patient. Patients need to be reasonable and well informed and should know the cost and risk and benefit of surgical procedures, as well as the failure to do surgery when it's indicated. I hope that helps a little bit, and if we can help you with your problem, we look forward to hearing from you. Thank you. Bye.